We have come a long way as far as understanding about pathophysiology of diabetes is concerned. Our approach towards management of type 2 diabetes patient from earlier days of being only a glucocentric approach. Today we are talking about atherosclerotic cardiovascular risk reduction. We are talking about benefits in terms of renal composite endpoints getting reduced through drugs like SGLT2 inhibitors. So what we today very popularly say that it is a care me approach. We are talking about cardiac benefits coming from SGLT2 inhibitors. We are talking about renal composite endpoints coming down with use of SGLT2 inhibitor, and also having a metabolic approach towards management of type 2 diabetes. So I'm sure these days SGLT2 drugs are being used by cardiologists for CV risk reduction, for reduction of hospitalization with heart failure. These are being used by nephrologists for management of diabetic nephropathy, for reduction of renal composite endpoints also. And we are also using these drugs for improving overall metabolic profile in patients of type 2 diabetes. So SGLT2 drugs, SGLT2 inhibitors are no more being used by diabetologists, but these are being also used by our colleagues in cardiology, by nephrologists also, and it has become more like a holistic approach on management of type 2 diabetes, where we are trying to reduce overall cardio renal risk in management of type 2 diabetes by using drugs like SGLT2 inhibitors. Yeah, I think there has been a sea change in our approach towards patient of type 2 diabetes during the COVID times. One most important thing is that we have also become very, very tech savvy. We are using more of teleconsultations. We are using uses of various health apps. We are also using WhatsApp app for messaging to the patients. In a way, this has become sort of more appropriate in this COVID times, or in this challenging times, that we are sort of more related to the patient. We are responding to their needs. We are frequently SMSing them to help them out. We are getting their sugar charts frequently, and moment patient shares his or her sugar charts, we tend to respond very, very frequently, and we are trying to help our patients so that they stay healthy without coming frequently to us. And even if they are connected through, say, video calls or through audio calls or through WhatsApp, in whatsoever way we can help our patient, we are trying to help them. That is very important. This was not there. In fact, teleconsultation was not approved in India also. And since the pandemic, in fact, MCI and ICMR, they have approved the usage of teleconsultation also, so that patient can reach to us in emergency, and we can help them out with in whatsoever best way we can do. Second is that we today understand that because patient is not able to travel, that is one. Many of the patients, they are sitting at home. There has been loss of jobs.